Hello everyone, I am Amardeep Kaur, working as a clinical instructor at Khalsa College of Nursing, Amritsar. Today I want to provide a detailed information regarding a very common and widely spread disease, that is conjunctivitis, and in common language we can say eye flu. So firstly, I will discuss what is conjunctivitis. It is redness and inflammation of conjunctiva, that is the covering of white part of the eyes and membranes on the inner part of the eyelids. It gives pink appearance to the eye, so called as pink eye, because of the subconjunctival blood vessel damage. It occurs in one or both eyes, but mostly it occurs due to viral infection. So next we will discuss the classification of conjunctivitis. Classification is according to the causes of conjunctivitis. First of all, this is bacterial conjunctivitis. Bacterial conjunctivitis is caused by bacterial infection, for example, Staphylococcus aureus, Streptococcus, and next is the sign and symptoms of bacterial conjunctivitis. Patient having discomfort, foreign body sensation, eye pain, burning sensation, photophobia means painful sensitiveness to the bright light, swelling and redness, discharge is there. Next we will move toward the viral conjunctivitis. A several number of viruses can cause conjunctivitis, but most common viruses are adenovirus, herpes simplex, and it is highly contagious and also associated with the infection of upper respiratory tract, a common cold and sore throat. The patient having viral conjunctivitis have the following sign and symptoms like watery discharge, itching, swelling, redness and enlarged lymph glands of in front of the ear. Next, we will move toward the third type, that is allergic conjunctivitis. It is a hypersensitivity reaction as a part of allergic rhinitis, or it can be an independent allergic reaction. So, next we will move toward the sign and symptoms. The patient usually has a history of an allergy to pollen and other environment allergens. Sign and symptoms are usually accompanied by intense itching. A patient having allergic conjunctivitis, so he or she may have intense itching, irritation, burning sensation, and there is a severe photophobia. Next type is the chemical or toxic conjunctivitis. It results when any irritating substance enter the eye like household cleaners, hair spray, foreign object in the eye or smoke. This is all about the classification of conjunctivitis. So next we will move toward the diagnostic evaluation. How we can diagnose the conjunctivitis, how we can rule out the conjunctivitis. So first the easy method is, as I told you earlier, this is a pink eye. So we can easily diagnose a person if having conjunctivitis. So he or she may have pink eye. Next, we move toward the diagnostic evaluation. How we can rule out the person having conjunctivitis. So, firstly, we can collect the history of the patient along with the symptoms that the patient is experienced. I have told you earlier. Next, we can check the visual acuity to determine the extent to which the vision may be affected, because due to conjunctivitis, the patient having blurred vision. Next is the evaluation of conjunctiva by using bright light. Next, the important part is the management. How we can manage the person having conjunctivitis. In 65% of cases, it resolves within 2 to 5 days. It has no specific treatment. We can just provide the symptomatic treatment to the patient. Like if a person having or if a patient having bacterial conjunctivitis, so we can provide the antibacterial drops or ointments. Next, if a person having viral conjunctivitis, so we can provide the antiviral drugs like acyclovir. It may be helpful to resolve the symptoms or to resolve the viral infection. The conjunctival sac should be washed with warm normal saline 3 times a day to remove the discharge. Next is ask the patient to lie on affected side so that discharge come from the affected eye may not come in contact with the good eye. Next is encourage the patient not to touch the eye because it may transmit infection to the good one. The personal belongings of the patient like towel, handkerchief should be kept separate and provide warm compress and artificial tears to clean the eye. People often advise to wash hands thoroughly with soap and water frequently to prevent from infection. Use cold compress for about 10 minutes 4 to 5 times a day to soothe the pain. Next, if a patient having allergic conjunctivitis, so the allergen has to be removed and topical or oral antihistamine may be used 4 to 6 times a day, and also we can provide the dexamethasone eye drops 4 times daily for several weeks to give the best relief. If a patient having chemical conjunctivitis, so we have advised the patient to wash the eyes with very large amount of water and continue irrigation antibiotic eye drops to reduce the irritation and also pain. Next is last is prevention. So infectious form of conjunctivitis are highly contagious and are spread by direct contact with the infected people. So disinfecting surfaces like sink, doorknobs can also be help to prevent the spread of infectious conjunctivitis. We also advise the person to avoid sharing the personal items and also advise to avoid touching and rubbing the eyes. So this is all about the conjunctivitis. Thank you.